Medicare Advantage has seen significant growth in recent years. With more plans available than ever, choosing the right one has become increasingly difficult. For many, understanding the differences between original Medicare and Medicare Advantage is challenging enough, and those who opt for Medicare Advantage often encounter hurdles like prior authorizations and limited provider networks. These barriers can make it harder to get the care they need or see the doctors they prefer. In this video, we'll explore the obstacles beneficiaries face in an overcrowded Medicare Advantage market. We'll look at the resources people use to make challenging decisions, why these challenges persist, and potential solutions to improve financial security and health outcomes for those with Medicare. For people eligible for Medicare, there are two main pathways for coverage: Original Medicare and Medicare Advantage. Original Medicare is managed directly by the government, while Medicare Advantage plans are offered by private insurance companies under government contracts. If you want more background on how Medicare Advantage plans function right now, you can check out our Medicare Advantage 101 series. Choosing between these options involves weighing factors like access to providers, supplemental benefits, and costs. One important but often overlooked consideration is access to Medigap plans. Medigaps are supplemental plans available only to people with original Medicare. These plans can protect against unlimited out-of-pocket costs, but complex enrollment rules limit who can access them, sometimes in ways people don't expect. For instance, many people who choose Medicare Advantage lose their chance to enroll in a Medigap plan, leaving them with fewer options if they want to switch back to original Medicare later. It's worth noting that in 2024, more than half of all Medicare enrollees were in Medicare Advantage plans. For these beneficiaries, the decision-making process likely involved navigating an increasingly crowded and confusing landscape of plan options. Back in 2018, the average Medicare beneficiary had 21 plans to choose from across 6 organizations. By 2024, those numbers had jumped to an average of 43 plans from 8 organizations. Asking people to evaluate dozens of plans based on cost, benefits, and in-network providers is a tall order. This is especially true for older adults, individuals with limited English proficiency, people with cognitive impairments, or those without reliable internet access. On top of the overwhelming number of plans, provider directories are often riddled with errors. Network changes can further complicate matters, leaving enrollees with plans that may not cover their preferred doctors or specialists. This forces beneficiaries to make difficult decisions, either pay out of pocket for care or go without it altogether. When faced with so many decisions, where do Medicare beneficiaries turn for guidance? The federal government provides several resources, such as the Medicare Plan Finder, 1-800-Medicare, and state health insurance assistance programs, also called SHIPs. However, these tools have limitations. For example, while the Medicare Plan Finder can help compare plans, it doesn't include detailed information about provider networks. SHIPs, which offer free, localized support, remain underfunded and underutilized because many people don't even know they exist. Without adequate government resources, beneficiaries often rely on brokers or agents. About 1/3 of Medicare beneficiaries seek help from brokers, who frequently steer clients toward Medicare Advantage plans. This trend may be driven by financial incentives. In 2025, brokers will earn standard commissions of $626 per Medicare Advantage enrollee, with rates reaching as high as $780 in some states. By contrast, commissions for standalone Part D plans are just $109, and there are no commissions for original Medicare enrollments. Why is it so difficult to choose the right Medicare plan? One key reason is the sheer number of similar plans on the market. Until 2019, Medicare required plans to show a meaningful difference to prevent organizations from flooding the market with nearly identical options. This rule was meant to limit confusion while still providing choice. When the meaningful difference requirement was eliminated, private insurers began offering multiple plans with only slight variations in benefits or cost-sharing structures. For example, in Nevada's 89178 zip code, There are 25 available Medicare Advantage plans. Of those, 10 are offered by Aetna. Two of Aetna's plans differ only in minor ways, such as a $15 to $50 difference in copays or slightly different over-the-counter drug benefits. With so many plans that are nearly identical, beneficiaries struggle to identify what sets them apart. This abundance of options benefits insurance companies more than consumers. By flooding the market with plans, insurers increase their visibility and attract more enrollees. Even if someone decides to switch plans, they're likely to choose another plan within the same company, ensuring the insurer retains their business. Enrollment growth drives profits for Medicare Advantage organizations. To better understand how, watch our video on the Medicare Advantage overpayment cycle. Medicare Advantage plans have gross margins that are more than double that of Medicaid managed care plans or group market plans. These profits allow insurers to offer enhanced supplemental benefits, incentivize brokers, and attract even more enrollees, creating a cycle that prioritizes growth over simplicity. How can making the right coverage choice be easier? Here are some potential solutions. 1. Reinstate meaningful difference requirements. Limiting similar plans would reduce confusion and make it easier for people to compare their options. 2. Standardize plans. Medigap plans are already standardized, and CMS is taking similar steps with Affordable Care Act marketplace plans. Standardizing Medicare Advantage plans would help beneficiaries compare options more easily and reduce the risk of discrimination based on health needs. 3. Improve tools and resources. Medicare Plan Finder could be enhanced to include accurate provider network information. Additionally, CMS could provide clearer notices to people nearing Medicare eligibility, outlining their options, timelines, and key considerations. 4. Increase SHIP funding. With more funding, SHIPs could expand their reach and provide unbiased one-on-one support to more beneficiaries. 5. Expand access to Medigap plans, ensuring that beneficiaries can switch to original Medicare with Medigap coverage would provide more flexibility and financial protection. 6. Strengthen marketing regulations. Stricter rules for broker commissions and marketing practices could reduce the influence of financial incentives and help beneficiaries make more informed decisions. Any combination of these measures could significantly improve Medicare's accessibility and transparency. Simplifying choices and providing better support would help beneficiaries secure the care they need while protecting their financial well-being. Right now, the system places too much responsibility on individuals to navigate a maze of plans without sufficient guidance. It's time to focus on meaningful changes that truly prioritize the needs of people with Medicare.